My name is John Jador. I'm from Yabugik First Nation, Conn River.
I'm Anita Cora. I'm Inuk from Nunatsiavut, and I'm from Maine, Labrador.
Conn River is a Mi'kmaq community of 840 people, of predominantly Mi'kmaq, but we have Mi'kmaq, European, Innu descent, and we've been a reserve since 1872, and now we're a very proud community that boasts nearly 100% employment, and we have Mi'kmaq language in the schools, and we're doing a lot of really cool things now. I think we're starting to come back to a place of being proud of who we are.
My home community is the most northerly Inuit community in Labrador, and it's a population of about 1,500, I think. The numbers tend to fluctuate a lot, but we're pretty decent sized. We're the largest Inuit community on the coast in Nunatsiavut, and yeah, you can only get in by boat or plane, and then in the winter by skidoo.
Yep. So in Conn River we have the Amelia Joe Medical Clinic, and Amelia Joe was the last traditional midwife in Conn River. We have two nurse practitioners, Dennis Benoit and Ada Roberts, and we have a number of LPNs, I think is the right term, public health nurses. I think we have two public health nurses, and we have a physician who comes to Conn bi-weekly, I think. The two nurse practitioners and the other nursing staff are the main, I guess, the lifeblood for the medical clinic, and everyone else is kind of coming on a cyclical basis, I think.
We have a pretty nice sized clinic there. We have nurses, and then a doctor will fly in every so often. We have dentists that fly in as well sometimes. We do have counseling. There's a Department of Health and Social Development, which is DHSD, and they do a lot of the counseling and mental health services. So if you have something more serious like pneumonia, if it's really severe, they will fly you out. And there are instances where someone's condition is so bad that they have to be medevaced out. So you'll often hear that in Labrador, this person got medevaced, and that happens pretty frequently. Sometimes these people that do come in don't really provide adequate services, and certainly not culturally aware or sensitive services.
To an extent, there is a trust issue. Same reason, just because it wasn't a part of their growing up, and now it's just kind of like a cycle where they're, in the same boat where they just, it's not high on the priority list to avail the services.
I would love to know why we don't have adequate health care in our communities. I know it's a combination of things where it's a lot of people begin not to care about their own well-being because either the services aren't adequate or they just don't know how it can actually help them or believe them because of their experiences, because they've been so discriminated against or made to believe that whatever issue they're facing isn't as serious as they themselves believe it to be.
If you introduce self-determination into the equation, then you'll introduce the participation of Indigenous people, because identity is just it's the ace of spades in the card deck of culture, and once you give people that opportunity to have their own choice in how they want to utilize the healthcare services you can provide, then you would see a higher amount of people taking part in utilizing those resources. I think that the tables are turning. We're having more Indigenous doctors, more Indigenous nurses, and healthcare professionals in general who can, effectively make that change on the, that preliminary level by being involved in the healthcare system. So I'm really optimistic that over the years, over generations, this will start to happen, but it's happening because of the introduction of more Indigenous people in the healthcare system.
Because the communities are ready, the families are ready, but it's other people that aren't ready to admit that they are discriminating and being racist yet. They're trying to change, but then the system is working against them, so then they have to continue being the same way because they're not allowed to continue that change that's actually going to heal people. And it's not just something for the communities, it is something for the whole nation. If we're a nation that advocates for good health care, then everyone deserves good health care.